Hi, I'm Julie.
And I'm Caleb. Welcome to Nursing You, the podcast where we redefine nursing in today's healthcare landscape. Join Julie and I as we step outside the box on an unconventional healing journey.
Together, we're diving deep into the heart of nursing, exploring the intricate relationships between caregivers and patients with sincerity and depth.
Our mission is to create an open and collaborative experience where learning is expansive and fun.
From the psychological impacts of nursing to the larger implications on the healthcare system, we're sparking conversations that lead to healing and innovation.
We have serious experience and we won't pull our punches, but we'll also weave in some humor along the way because we all know laughter is often the best medicine.
It is. And we won't shy away from any topic, taboo or not. From violence and drugs to family and love, we're tackling it all.
Our nursing knowledge is our base, but we will be bringing insights from philosophy, religion, science, and art to deepen our understanding of the human experience.
So whether you're a nurse, a healthcare professional, or just someone curious about the world of caregiving, this podcast is for you.
One last thing, a quick disclaimer before we dive in. While we're both registered nurses, nothing we discuss here should be taken as medical advice. Always consult with your doctor or a qualified healthcare provider for any medical concerns you may have. The views expressed here are our own and don't necessarily reflect those of our employers or licensing bodies.
So let's get started on this journey together. Welcome to Nursing You, where every conversation leads to a healthier world.
So we're going to read what you wrote, or what AI wrote, I guess.
Yeah, what I got. Yeah.
Read what you wrote.
Because then it kind of goes down and it talks about, here are some strategies nurses can use to cope with this unrecognized grief. And I think that's what it is. We are not visualizing the grief as it comes into our bodies. We recognize the grief when it manifests into an unpleasant situation in our lives, whatever that may be. And then I don't think a lot of times we recognize it as the held grief, the held mourning, and the energy of situations. Because just like that says, it's like I worked yesterday, surgery, and I got let go at like 11:30 or 11:45. But they needed someone to be on call for the inpatient unit because there was no patients, but if they got an admission, they needed a second nurse. I was like, that's fine. Till 4:00, I can do that.
Yeah.
So I went to Walmart, of course, they could get a patient. I was like, oh, okay. I'm going back, which was fine because it was on call pay. And I knew I wasn't going to be the one to take the patient. I was the second. But anyways, I worked with this girl. Things are always just for a reason. Like they're just for what is going to happen. She lives south of the hospital, our hospital, and it's just easier for her. So, and she's PRN, so she's picking up. She's on this kind of PRN contract that they have. They like try to manipulate you to get you to work, and they try to make you think that it's like for your best and that you're getting something out of it. But anyway, it's like free labor. But she isn't. So she's managing, working the system as I told her to. But she's young. She's maybe she went to nursing school. I think she graduated in like 2021 and then worked on the COVID unit.
Oof.
Right into it. So anyways, she was telling me a story. She was like, I was the most seasoned nurse on the unit and I was like 2 months out of school. Yeah, that's how they can do it. That's fucking how they do it. And she told me too that during her preceptorness, when she was being precepted during her orientation, her preceptor, it was the height of COVID. So her preceptor had like 5 patients, and rather than having like 3 or 4 of their own, she had 5. And then this girl, the new nurse, had just a couple of patients on her own. She was going to be on her own with those, but yet still be in orientation and have a preceptor. So it's all bullshit and lies.
Right.
Yeah. So they're just taking advantage. Anybody will do like whatever. And I get it. During COVID, that's fine, but it's not right still. So she told me that she went to go check on her first patient. And when she walked in there, the patient was barely breathing, was on a PCA pump. And she was like, oh, holy shit. She knew something was wrong. She knew she needed help. And she was like, I sat down there on the bed and I counted his breaths and it was like 4. And I was like, she goes, and I knew I needed to do something. So she goes out to the nurse's station. No one's there. Everyone's giving bed. Oh, I know what it was. This will make it better. She ended her 12-hour shift orientation and they were like, can you stay a little bit longer and you can keep like your patients, you know, when you're orienting with a preceptor, as you get towards the end, you kind of take care of your patients and she's just looking over your shoulder. You might not get a full load, but those are yours. So she kept maybe 2 or 3 of her own patients after the shift was over with no preceptor. So she goes in there, finds this, goes back out to the nurse's station. No nurses there. They're all giving bedside report, no aid, no nothing. So she pages the doctor and basically is like, you know, I'm getting ready to give Narcan. Can you please put in orders? I shut the PCA off. He's, you know, somnolent, blah, 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 you know, gives her good assessment. And the doctor gives her orders. So she goes in there, she gives Narcan. She was like, I gave it 5 times, Julie, 5 times. And the doctor came up and the patient was okay. So good for you. Good for learning your instinct. She was like, after that, I was so traumatized by that. I went in the break room and just started crying.
Oh,
I said, well, you were releasing. That was a lot of energy you had. That was a lot that you had to deal with. You were using your mind. That's very scary. And she said from then on, for like the next 2 years, they called her crybaby. And then
shut up. No.
Yes.
Oh my gosh.
Like she was known as the crybaby.
I just heard a similar story. A really smart girl, a friend of mine's daughter, just graduated nursing school this year and was so excited she got hired on at the ICU. And she got there and they just tortured her. It was never about her, the care she provided. It was how she made the bed. It was how she cleaned this or organized that. Like it was all bullshit. They just didn't want her for whatever reason. It's just so wrong. It's a double-edged sword because, you know, we've talked about it before. All of those salty, leathery old nurses that pushed us to be better made us better.
Yes, but they pushed us in a way that like challenged our mental capacity. Like
that's true.
That is true. Education and challenged they weren't just down and right and nasty. They were kind of opposite of that. Well, there was one, and you know who I'm talking about. I know.
She had when I quit after all those years, there someone other than me, I never once went to HR for anyone. Someone else went to HR 5 times for the abuse that she put me through. 5 times. Isn't that crazy? So crazy. And it was spiteful. It was just to be mean.
Well, so there you have it. But, you know, the ones, God, I don't know. Does it make a difference? Is it necessary? It's like hazing. It is what it is. And does it make you stronger? Maybe. She remembers that. I mean, could you be the nurse that you are today without having some of that hazing going on? I guess when you hear it back, I was never one to haze. So
nor was I.
That it makes me sick when I hear that for another nurse. But, you know, it just to hear, it's just so stressful. And you hold that in because you don't want to be called the crybaby.
Right.
You don't. And so you hold it in because you have to maintain this kind of professionalism, you know, and we're not just run of the mill. Like it takes a lot to get through nursing school. And it takes a lot to be able to continue to work on the same unit and thrive at it. And you can't be so emotional.
Mm-hmm.
I mean, I say I wasn't the mean one, and I don't think I really ever said anything, but I could not tolerate the criers. I guess I would say, like you go off the unit because don't cry in the room. Don't come to the nurse's station and cry. Take care of yourself and go out, take a minute and then come back. but I kind of feel like I wasn't as gracious as I could have been because I didn't know either. But if I were to go back now, it would be different, I think.
I mean, I've kind of almost lost the ability to cry at this point. It's something that I recognize that I know that I need a big cry.
Oh.
Like I need a soul cry. Like just let it out. But I don't know how to do it because I've stuffed for so many years.
That would be an interesting experiment. I definitely cry a lot more now or well up emotionally that I'm off my antidepressant.
Sure.
Because I never cried. I never cried. Even about patients and even about really like tremendously emotional, like handling the dead baby, dressing the dead baby, going to get her out of the morgue multiple times during my shift because we had the mom in the ICU. Because she had bled out and had to have surgery, and then we got her and she was vented and then she was extubated, and I had her back-to-back nights. And I knew that I was going through what I was doing was like, I cannot believe you're dressing this dead baby. This is crazy. But it was like you couldn't penetrate,
Or maybe, I mean, it could. What do you mean it couldn't penetrate?
Like the grief that mom felt for that baby. And I had kids too at the time. It's almost like I was able to stay outside of it so that it didn't affect me emotionally, and probably unconsciously chose that because it probably would have taken me down. Like I probably would have had to just leave work. And so I don't know. I've cried about that baby since then, having thought about it and talking about it. I actually talked about it with my mom because she was a labor and delivery nurse for a long, long time and had to kind of do some of those similar things. And so her and I just got into a discussion about it. And she kind of reminded me like how deep that is, the soul and just the mother and the father and the grief and what I provided for them. I provided like this kind of gateway so that they had the opportunity to continue to see the baby. And we couldn't leave her out very long because then she would get weird. So we had to put her back into the morgue.
The mom would get weird?
The baby.
What do you mean?
Well, because as she warmed up, she wasn't alive. I mean, she was, and so we couldn't leave her out for very long because she just started turning weird colors.
Oh God.
Yeah.
I mean, so I'm still kind of stuck on what you said about not being able to penetrate. Like, I feel like could not penetrate so deeply.
Yeah.
Like it penetrated so deeply that like a part of you had to form around it.
Okay. Well, and that is another way to look at it, that it could have penetrated me so deeply that I guess when I think of like, I ask, why wasn't I crying? Like, why wasn't I crying with the mom? How was I able to do? I did go sit in the chapel for a little while. I was bothered. I guess the more I think about it, I was really bothered. But
I mean, how could you not be?
You just keep going. I just sat there and I think I just asked for strength for me to continue to be able to care for the patient and do what she needed done, which was
so this is such I had so many thoughts when you sent this topic because I think that we can't, like, I can think of situations similar to this that I've experienced that were so far beyond anything that I could have ever expected to experience in life.
Yeah.
And for that reason, I didn't have not a formulated response. I didn't have any context for it. I didn't know how am I supposed to respond in this situation?
Yeah,
It's
you're right.
so
Yeah.
fucked. Like,
Yeah.
it's so fucked. And I don't even know, like, there's like, it's kind of like what I've said before about when I tell my friends and family about the experiences that I've had, they cannot, no matter how intricate and precise the words that I use could ever be, there's no precision with which I could communicate that experience that would make them experience it.
Yeah.
It's not possible. And so there is no like, because we compartmentalize. We innately, like, we have to compartmentalize. Like, as nurses experiencing the things that we experience, we have to compartmentalize. And it's like some of these experiences, there is no compartment for it, and you don't know what to do. And I think, especially there's a couple of things that it brought up for me. The baby is representing life, potential. It's representing potential. And one of the thoughts that I've had, I recently had someone say something to me that sparked this idea. It was a young person that was talking about their mom, and said she comes home who's a nurse, comes home and she just sits in the dark, or she just wants her boyfriend. And there were, this is a young person, and this person, I don't think sex was even a part of this person's consciousness to be able to say that, to imply that to me.
Yeah.
But that's where my mind went, is that this person is just, carrying trauma and grief and the stress, and it goes to sex.
Mm-hmm.
And the response is sex. And it caused me to think, like, when we have these experiences that have no place to go, and because you're holding a dead baby, and so it brings into question your own existence, your own potential. And when that part of us is challenged, I think that it's natural to throw yourself into, one, the procreative state, and two, a place where that can all just go away. Because when you're so focused on the intimate act, all of that is gone. Yeah. All of that, you don't have to confront that compartment that you can't find, that you don't know where to put. So you throw yourself into intimacy, and because it's a procreative act, it's a very creative act. It'll be crude. She's crazy, so she must be good in bed. Or he's crazy, he must be good in bed, right? Yeah. Mm-hmm. Like that idea that maybe this person, maybe because there's probably some truth in that. I think there's some truth in that. Maybe it's the inability, like the inability to contextualize their experience allows them to just to be free in that way.
Right.
And it makes perfect sense. I mean, some of these I can't remember the name of the Instagram page, but essentially it was a tell-all, an anonymous tell-all. And the stories about nurses and sex were outrageous. They were outrageous. I couldn't believe it.
Wow.
And so that when I read through that Instagram page, it was that these ideas started formulating then. And I think there's probably some really valid truth to it. When your existence is brought into question, it makes sense to respond in a procreative way.
Just a release, an energetic release, a place where it's not required to think about anything. It's just your body's, you're just going, it's just natural to you because you don't have to think. And it's just a form of release, just like it feels like when you take a drink in that first 20
Yeah.
minutes of that.
Of course.
Or I've never gambled, but I can imagine that it would be similar to that dopamine release. And I mean, imagine all the chemicals that are released, during sex.
Oh, sure.
So it's, I mean, you're caretaking for yourself, but also if you don't kind of deal, and that's a very weird generic word, but so if you're always burying or hiding from the emotions that are changing due to your external circumstances by using an outlet or going to that release place, whatever whatever it is your choice is, then you have some relief in the moment, but all of the shit just continues to pile up. So it's like you have release in the moment, but there has to be, if you could have both, I guess is what I'm trying to say. Like if you could have the release, because they in therapies and energetic work and stuff, they talk about, well, and here's a perfect example. So an animal who has just run from a threat, when there's no more threats, they shake. So they shake it out. They shake their body, whoa, and they shake it out. Well, they're shaking all of that energy and all those neurotransmitters and this everything that's surging through your body when you're in that like threat state. They naturally release it,
right?
Where humans don't, and they might do that and feel feel a release during whatever they're choosing, alcohol, sex, whatever. But is that it? Or, I mean, for me, it seemed my choice was alcohol. So I would drink to release, but I never dealt. Like I never did any shaking. I just got the feeling, but I didn't actually make my body intentionally release that energy. And so I feel like it just stored and stored and stored and stored until there was no more room.
Right.
And thus, you're like, everybody's breakdown is different. It looks different. Or you just still struggle and you just try to keep going. And I mean, I think about going back to like an ICU. I think about it every time I walk in a hospital, or when I look on our ER little board and then I look at the bigger hospital's ER board and it's like this long and all the colors, and I'm just like, oh my God, like that just makes me nauseous. Like it really does.
Yeah.
I think.
Well, it's like all of the things that need to pay attention, that the nurse needs to pay attention. Those boards, they're color coded so you can recognize the thing that you need to recognize quicker, and the noises have to be different than the other noises so that you can hear them, so you can know what's alerting you. And it's like all these different systems are screaming at you and competing for your attention. It's just crazy. It's so much.
So much.
I had a mini anxiety attack last night. I was looking at Instagram for the first time in a couple of days, and someone sent me something, and it had ventilator noises. It was a nursing account that the girl was like talking to her partner. Do you mind if I put on some white noise? And she turned on ventilator noises. And it's like, oh my God, I can't breathe. It's so terrible. Oh, beep 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 beep.
Oh, yeah. But these days, because I had a little bit of a mini anxiety attack yesterday too. It didn't have to do with nursing. It had to do with, I just am in a season of lots of things to do. And this school trimester is a lot. It's the heaviest one of the whole, whatever it is, all the semesters. This is the worst. It's just the heaviest. There's a lot to do. And we're also trying to paint our kitchen ceiling.
Mm.
So everything is displaced. And last week I was like, I'll put the laundry away next week. And, there's the plastic sheets hanging over all of our cabin. Anyways, I just walked in and I was like, like, I feel like I couldn't breathe. I had to take off my clothes for that, my shoes. I had to go outside. And before I was really realizing what was going on, Joey's choir gown was just like on the couch, wadded up. So I walked down there and I was like, what is that? And I picked it up, like, this needs to be hung. I hung it in his closet. And he's like, no, mom, I'm hanging up out. I got to take it to, and I was just like, but fairly quickly and quicker than before, I was like, wow, Julie, what's going on with you?
Uh-huh.
Let's take a few minutes and figure this out.
Right.
And, my environment affects me a lot. So if it's organized and things are like, I have no more underwear in my drawer. Like I've none. So I like dig through the basket, and that doesn't matter for maybe some people, but for me, I was just like, it was too much. But I think now, don't you agree? We can kind of recognize what is going on with you. Whereas for me before, that just would have been like a rampage. I would have been pissed the rest of the night. I probably would have just had to go to bed. Like I wouldn't have been able to deal with anybody. And they would have just rolled their eyes and been like, oh God, mom's in a mood, kind of like that. But I was able to recognize, ask myself what's going on. Oh, okay. And then be like, see, all right. So then Joey came up later and I just said to him, I was like, bud, this is this, and this is this. And I said, I apologize for my behavior. I'm sorry that was how I presented all that. I could have done that in a different way, but here's kind of what I was going through. And he was like, oh yeah, well, that makes sense. Like, he didn't think two shits about it, but I just thought that's growth.
Sure.
To be able to recognize that the things that even give us anxiety.
Mm-hmm. Well, I know that I'm at the hospital 4 days a week and I'm overstimulated. All those sounds and lights that are competing for my attention are so overwhelming. And I come home and, I've got a teenager that is kind of on her own program. And if she starts pushing my buttons, it's kind of on. I can't handle it. And a lot of times I just go into my room and she can't understand that. Right. I came home the other day and the dishes, I've been asking for 2 days. I clean my dishes. Like, you need to clean your dishes. You're old enough. And, I wanted to just carry him into her room and put him on our floor, but I didn't. I held myself back. It's just like it just pushed me over my edge, and we had a fight, and she can't understand that, like, something so simple as dishes. I mean, it doesn't even matter. I mean, it does. Like, she's old enough to know better, and they should have been cleaned up right away. They shouldn't be sitting out, and you're not a baby anymore. But I went to my room and I was just like, you didn't have to, I don't know, you didn't have to get so mad. And I think that happens more than it should. And I think I'm just so overstimulated in my day, just like the nurse I was talking about earlier. She needs to sit in a dark room. Yeah. Like, I need to sit in a dark room. I can't have any more stimulation today. Yeah. And like, what is that? Like, so we get aggressive and mean. That to me, it seems like, as we're talking about that, as I'm talking about that, it seems like it's pushing away the people that we love so that we can have a safe space for ourselves to decompress. Yeah. And I think that is, like, for the people that are going to listen to this that are family members of nurses, I think that is one of the most important takeaways that they could hear us talk about, is that your family member that is overstimulated and overexposed to extreme circumstances just needs quiet.
Yeah.
Just needs to be left alone for a little bit, and needs to be approached with some gentleness and kindness, because we've been taking on a lot. A lot.
Well, and I think in the beginning, when nurses come home and need that, they can't really express why, or it's just they're kind of.
Well, I mean, we're like 15 episodes deep into long format conversation about this, and we still haven't fully articulated it.
I know it. So, family, until they can explain it, because sometimes I think we don't even know why we need it. I mean, yeah. Oh, it was a stressful shift. Okay. But your family, like we talked about, nobody can really know. If two nurses lived together, you'd be like, see you in a bit. You'd just be like, got you. I got you.
Yeah.
But it's a very hard, because, dads want to be dads and moms want to be moms. And so there's this internal struggle of, oh, good, I'm not at work. I can be home with my baby. I can be home with my spouse. We can go do things. But the hospital does not leave your brain like that. It doesn't leave when you pull out of the parking lot. It is in there. It is affecting you. It is in your DNA almost. It's very, very challenging. And I would probably, there's lots of other careers that I'm sure are very similar in that. And it takes some finesse. It takes grace, giving the person grace. And then also for that person to learn to be responsible with accepting the things that have been shown to them that they need for self-care. So if what you need is quiet time when you get home and you need to just be in a dark room, being able to articulate that to the people that you love so that it's presented as something that you're doing to take care of yourself so you can be better for when you are around them. But kids don't really understand that a lot.
No, she doesn't understand.
No, I don't know. It's hard because so we push ourselves. We push ourselves a lot. We push ourselves out of that. We push self-care to the back. We push the things that we should be doing to take care of our minds and our mental health. They're lower on the totem pole.
They're lower priority. Yeah,
totally.
Yeah.
And it's almost out of survival because you're trying to survive and you want to have the family and you want to have the kids and you want to be there and you want to have interesting conversations with your teenagers and you want to, explore things with them. But it's, when you're working a job that is so demanding, I mean, can you have both? I don't know, because I only work at the hospital one day a week for that very reason. And the other job that I do is very, very subdued. It's the little mini PICU, pediatric intensive care, the SAP monitor, the vent, the trach, the feeding, but it's just one and it's quiet and it's just him and I, and it's very controlled. And that's what I have to have. I could not go back to an environment, so that's why I'm asking, can you have it both? Can you work in a crazy environment in a nursing, fast-paced, even on a med surg unit with 7 patients a night? Can you do that and have a healthy mental state that you can have amazing interactions with your family? I don't know.
I can only think of one nurse that I've worked with in the last 20 years that I look at her, and of course I don't super close with her, but at least it would appear on the outside that she's been able to do it. There's only one that I can think of.
Yeah.
Maybe we should invite her on.
Let's do it. Because I would. I mean, again, we don't have all the answers. We only have our own stories and what we're doing to try to heal ourselves from within. Yeah. And, getting other people's perspectives on things that have worked for them, because leaving the hospital should not be the only option. You should not have to leave, because I think you can say it. I really enjoyed when I was at work. When I was there, most of the time, I enjoyed it. I loved using my brain. I loved the excitement. I loved there was a lot of things that were shitty about it, but I really did. I mean, I stayed there for so long. I really did like it, but I didn't like the way I was on the outside.
Mm-hmm. Well, I mean, I've said this before. Like I think I said it in one of the early episodes. I was talking about the ICU boys, the CVICU guys, that are so arrogant and think they have all the answers and know everything. And that stereotype it's very funny. The memes are so funny about that. God, so great. But it's that, because we have so much working knowledge, we have the answers. We do have the answers. That's what you're enjoying, is that you have real problems and real solutions, and it's real time.
Yeah.
And that is intoxicating. So that was the intro. That was
right. That's 40-minute intro. Our topic was pretty much grief and the grief that nurses deal with in their career. And so this is what we wrote. Nurses often carry a hidden burden of grief from their experiences on the job, particularly in acute care settings. This grief can accumulate over time, especially when they suppress or ignore it in order to maintain professionalism. Because nurses are trained to prioritize patient care over their own emotions, they may not realize the extent of their guilt until it manifests in physical or emotional ways. And so then we're going to talk about ways that you can cope with the unrecognized grief. So you don't really know it's there. You don't feel like you're sad and grieving. You're not grieving like, you lost a pet or you lost your grandmother. It's different. It's a different kind of grief. It's like a grief for society. It's a grief for all of the traumatic things that people have to go through. It's a grief of having to leave your family and go do that job. It's a loss of something to gain something else. It's very, very, it's like, why do you have to give up something to have something? I don't know.
It's just another one of the paradoxes of our reality.
Yeah.
I mean, but and back, the idea that the paradox is the answer.
Right. Yeah. And there you go. And we're done.
Yeah.
Yeah. One would be the first step in coping with grief is recognizing that it exists. Nurses are often expected to be strong and resilient, but it's essential to acknowledge that witnessing death and suffering and loss takes a toll. Nurses need to allow themselves to feel sadness, frustration, or anger, and understand that these are normal emotional responses to their experiences. And so what comes to mind when I read that is almost saying to yourself, this is rough. Like what I just did, that was hard. And I may feel a little grief about that. Or it's possible that this may affect me, maybe not right now, the rest of my shift, because, shit. We can code a patient in 10 minutes and be right back in there doing your job. You go, boom, saved a life, right back in there.
Yeah.
Now you got to run to the ER, So it may not be in that moment, but almost like a reevaluation of your shift afterwards. Like, you did some hard things today, Julie. You experienced a lot. That was hard because losing anyone is hard. Putting anybody in a body bag is hard.
Yes.
And it's hard because it is the end of a life. A soul has left the earth. And not only just that, but all the circumstances around it. So dealing with the family's emotions, dealing with things that maybe you think maybe should have been better and maybe he wouldn't have died. Should we have coded him longer? If we would have intervened earlier, if the doctor would have called me back, all those things that we think, that all goes into a patient dying or just suffering. I mean, how many times have you said, this is ridiculous? Like this patient,
we need to stop. We need to stop this.
This is where he's rotting from the inside.
Yeah.
Like, we need to let this go.
We need to. Yeah.
Those feelings what do you do with that? You know? And so maybe suggestion would be like journaling about it. And if you're not a journaler, because I try to journal, and sometimes I'm just afraid of like what's going to come out, and that it's going to take me off the rail. Sometimes I can do a good job of it, but it's probably when I need it the most is where I back away from it because it scares me. Yeah.
I don't know. One of the things that was coming up for me is the idea that I've shared in the past about Piaget's object permanence, like that we are trained to believe, we have to be trained to believe. Like our base is that it doesn't exist. So the baby comes in the world, and as it's developing, it comes to understand through repetition that something has permanence.
Mm-hmm.
And so at the very beginning of our lives, we had this idea that there are things that are permanent. And that is like because it's so early and it is so deep that something can be permanent. And then as we continue to grow, we realize things aren't permanent. And then we have to square these two things together. And then we're in this position where things are so dramatically not permanent, so dramatically unstable. And so it is, our lives are so tenuous, we don't even know it.
Mm-hmm.
But we are constantly reminded of that. There has to be a grief just for that.
Yeah. It's almost hard to put into words.
I mean, that was the best I could do. Is just,
yeah.
I mean,
Yeah.
I don't know that I landed the plane on all wheels yet, but that's my best approximation.
Well, yeah. I mean, again, it's hard that's why it's hard to talk about. So it's hard for even nurses to put into the words to talk about it. But I guess if you can do your best by putting words down on paper or just exploring, is there anything about that you are feeling a certain way about? Maybe just start recognizing those things that come up for you rather than like me just like shut the door, shut in the closet, hurry up. I didn't want to think about work. I did not want to reflect.
No.
I didn't.
No.
I didn't. I only wanted to deal with it for those hours that I was at work. And then I literally like shut the fucking light off.
Yeah.
And I left.
Well, I mean, sometimes that's all you can do.
I know.
Until you can't.
Yeah.
And then you end up like us where you're thinking about it and
are so affected by it.
And are still affected. Absolutely.
Yeah. Death in a hospital setting is often rushed with little time for closure. Nurses can create their own personal rituals to honor the lives of patients who have passed. They don't have to be elaborate. Simple actions like taking a moment of silence, lighting a candle. That's funny. Not in the hospital.
Yeah, right.
But at home, maybe you could do it at home, or even saying a prayer. Just providing yourself a sense of closure. Writing letters to deceased patients, and this would be more like, think of those nurses who, like oncology, who have to take care of those patients every day. And I only experienced that one time, kind of through COVID, but before COVID, it was just one time, because once you got better, you go out of the ICU. Then you're on the floor.
I'm sorry. I'm not even paying attention. I'm dreaming about us designing a grief candle.
Oh.
And then making it merch.
Yeah.
Like, nursing you grief candle where we can
to just let it go
thing, and then people actually have a tool for that, for processing that. I don't know, just an idea.
Well, a journal and a grief candle.
Yeah.
And a mug.
Yeah, because we need our coffee. Because we aren't stimulated enough.
or a tea mug. For tea.
Yeah. Well, it also reminds me of the idea of having nurses write their stories and then doing ceremony of the dead, our own little
Yeah.
ceremony of the dead. I'll build a like a funeral pyre
Yeah.
that we can put all the notes on, and then we'll just
Yeah, we could do it over video.
have a group in person on video, something.
Or local.
Record
but it would be
it.
nice,
Record it.
anybody anywhere could write in their story that they were just wanting to release.
Yeah.
And even with the intention of release, the act of the energy, the release of the energy of it, that does actually make a difference.
No, I've experienced that.
Yeah. And it seems silly and kind of like how we talked about positivity, but it actually does. It actually can make a difference. Seeing that burn and then getting kind of a new slate, like that is no longer. It is no longer, because now it is a whole different substance. It's not what it was before. Rituals, I mean, they're so old, but they're very powerful if you can
Absolutely.
find some that work for you and give you meaning and allow you to, whatever your intention is for the ritual. It's similar to, I mean, it's just so hard to, they talk about debriefing, but I think all of this is debriefing in a way.
Yeah. No, we're debriefing for sure.
Yeah. So I don't know. I would love to experience an immediate debrief.
Well, the last code that I ran, we did an immediate debrief, but it was purely objective. It was just an analysis of what happened and what everyone thought went well and what everyone thought didn't go well. And it was, I mean, the objective aspect of it, and I would say there was, the one thing that was said was that, we did everything we could to give him the opportunity to revive, and he didn't, and there's nothing more that we could have done. And that was comforting.
Yeah.
That is comforting. Even though the rest of it was all objective, that one statement that was said was like, yeah, no, that's exactly right. We did everything. There was nothing more that we could have done.
The codes that I've been in, lots of them, but lots of those codes, I can remember the physician basically offering, does anybody else have any ideas?
Always.
And,
yeah.
And that's a piece of it. And so if you're in a code, take those words, because that he's kind of putting he or she is putting a finality to it.
Yeah.
Before it's actually
we are trying everything.
Yeah.
We're open to try anything that you can suggest. Yeah.
Right. So that at least peace of mind for that situation, it can't change anything leading up to any of your thoughts about his care prior to, or why this happened, or who didn't do what, or who, but at least for the moment of, is there anything that anybody feels like we should do before we call it? And I think those are very powerful words that should be used for processing. And I don't think a lot of people think of it like that. They're just like, oh, okay, well, no, I don't know, no.
Yeah.
But it's really more of if you can use it as kind of a ritual.
Yeah.
Like, we've done everything we can for this human, and it's their time.
It's their time. How many codes do you think that we've run? How many codes do you think? Just like how many think we ran together? I mean, how would you ever figure it out? How would you ever even begin to calculate?
I don't know, because some weeks I'd code 2 people a shift.
Yeah. Multiples in a shift.
Like 5 or 6 a week. But then sometimes, it'd be the week and you'd be like, what's going on?
Yeah. Nobody's got in.
What's going on? You might get a little reprieve.
Yeah. I've tried to think about that in the past.
Yeah. Reminiscing on your experience is, I mean, I feel very proud. I feel proud. I mean, I feel proud. I always felt proud to say that I was a nurse and that I worked in the you.
Mhm.
I always felt proud. And I feel proud to say I'm retired now, really. I am a retired ICU nurse because it leaves it as it is, you know. Like I
Mhm.
don't have to miss it. I don't have to pretend like I never was. And I think it gives context to our experience. You know, if you say I'm a retired police officer, I'm a retired firefighter, like you're like, oh, okay. You've been through a lot, you know,
Mhm.
or I was in the military, or I was, you know, I went overseas, or I was in a war. You know, that's kind of, I mean, it's funny we compare nursing to a war, but that it is kind of what it feels like. It was like we were in the trenches for the time that we were there, and now, you know, and now we're not. I'm not. Do you feel like you're in the trenches still, or is it different in where you
Oh
were?
no, not like we were. Not
Not
like
like you.
we were. No.
Yeah.
I mean, I'm still right there, but it's nothing
Yeah.
compared to what we
Yeah.
went through. Like my early career.
Yeah.
Like I just don't put myself in the position. I mean, I'm
Right.
still definitely in the position. I mean, like, you know, I just had a pretty traumatic code and death recently, and I'm still exposed to a lot of violence. So in that way, yeah, I'm still very much on the front line. But the people aren't they aren't sick like they were sick when we were working together. That was exceptional, and I have no desire to be in that setting. I don't. I could. I could do. I mean, I did it. I did go into those settings during COVID, and I was able to perform. It's just so second nature. You don't even think about it. You get put in that situation, and you're gonna do the things because there's like because just the innate knowing that we have from the experience that we have makes us immediately valuable. We know what to do. We know it needs to be done right now, and we just do it. And but to voluntarily subject myself to that now, I'm not interested. I really, you know, the conversation we were having about, you know, the interactions that I have with my daughter, I feel like if I want to have a relationship with my family in the future, I have to leave nursing. I feel like I have to leave this thing that I'm tremendously skilled at. The problem is I don't know what else to do. I mean, I'm a great woodworker, but I made up my own thing. Like I invented my own thing. Nobody cares. Nobody knows about it. And it's so niche that I have been unable to make it successful in financial terms that it would give me the freedom to do that. So I have to find a new path. I have to do something different if I'm going to, you know, keep things together with my family.
Yeah.
And I think it's probably time. I think it's just time. I need to step away from nursing. There are days where I'm angry. There's in one of the earlier episodes, I held back and I said, I can't say that out loud.
Mm.
And it was, I still feel uncomfortable saying it, but,
Oh.
so what I wanted to say, and I'll say it now. I look forward to the day when the only dick I have to touch is my own.
Oh. Whoa. Well, I mean, there's a lot to be said there because that is something that nurses do a lot of.
Oh my God. I avoid it as much as possible.
Yeah.
You know, it's just, I don't like starting catheters. You know, I used to like the procedural element of it. You know, and you know, when somebody's, you know, like I don't mind it so much. Like when, like, you know, I had this old guy that was in so much pain.
Mm-hmm.
And, you know, when there's like a real relief and they're so thankful, like that's, you know, there's a satisfaction that comes from doing that work, you know, of course. But I'm just kind of over it. I enjoy talking about our experiences, but I need to, but what do? I think I'm so, I don't want to say pigeonholed. I'm in this strange place where I'm tremendously talented and don't know how to reroute that knowledge and talent.
Yeah. And I think that's where I was a couple of years ago. It's like I'm wasting my skills. Like my skills are not being used. And I just had to mentally wrestle with it and say, you used them a lot. You use your skills a lot. And it's okay. Kind of like when the old man at the old mechanic has to just put his shit down. He can't hold it anymore. He doesn't have a grip like he used to, and I just had to make it okay in my mind. Like that was your era and your era is over. I felt the same way when, we used to go out all the time downtown and to the bars and your friends, and it's so fun, and you have and then we moved out to the country, and then we had kids, and it was like a grieving process for that era. Like it's not that anymore. It's just not that anymore. And then you have the era of when your kids are little, and you get the Halloween and the costumes, and you're buying their clothes, and so then there's that era. So I just had to look at it like, that era, you were so great at it. And I am thankful that I was there and that I did that. And now it's someone else's turn. And now I'm going to do this. And that knowledge that will never leave me. I'm not going to give it up. I'm just not going to subject myself to that kind of environment anymore.
Yeah. I don't want to subject myself to that type of environment anymore.
And so, this job with the hospice, maybe that will come to something. So maybe the more you get to work, maybe that's your transition. And
I don't know. I would like to do something that is where I see, that was part of the choice to go to PACU was, that people get up and I get to see them be better. Perhaps I think I would like to see more of that, more of people just being normal people and not me like, are their fingers clubbing? Are they, I'll still notice things, but I don't want to be so hyper diligent about other people's shit, man. Yesterday, last night, my son and I were driving down the road, and it was in my folks' neighborhood, and she's laying on the ground bleeding. She had fallen. Her dog had tripped her up, and she fell. And I stopped, and my little guy, before I was even stopped, he had the door open and jumping out to go help. Like, he didn't even think twice. Like, I was like, oh wow. It's right there. He's a little hero. And we stopped and we helped her. I did a quick exam, and then we took her back to my folks' house, and I cleaned her up and cleaned her wound, and I stayed with her for about an hour to make sure, she was adamant she was okay, that she had just bumped her nose. And so I stayed with her and did a full assessment and cleaned her and talked to her for an hour. And it's like, I love that. I love that about myself, that I am that person that is willing to help, and that those opportunities, like I felt like I feel like those encounters are opportunities that I've been given.
Yes.
Like I like, maybe I don't know if I did something bad to like need something to counter it, like, what did I do yesterday that was wrong that I need to make up for, that I'm getting this experience, this opportunity to help? Does that make sense?
Yeah.
Or maybe I did something good and I got the opportunity to do something even better, to help someone in need. So I enjoy that, but I'd like to use my mind for something else. Just don't know what yet.
Well, and it is so great that we have a choice. We always have a choice about everything. No one's stuck. You feel stuck, but you're not.
Well, I mean, I do. I feel like our knowledge is so specific, and like, we're crisis managers.
Yeah, but you can narrow that down to help you and benefit you in whatever you choose to do.
Yeah. No, I know that's true.
And I think we're putting a lot of that into this podcast.
Yeah, absolutely. Absolutely.
We are.
It would be awesome if this would take off and we were able to
just do this. That would be
do this. That would be awesome. Yeah.
So we'll just, again, ask for what we want, which is this podcast to blow up, and
like, share, and follow.
Write in, go to our website that has all the information on it. You can put your email in, send us a message. That would be great.
Mm-hmm.
Topics you want to know about, talk about. If you want to be on the podcast to tell your story. We have a lot of people in the waiting, but I think that's what this is all about, really.
Yeah.
It's so neat how the light's coming in on your woodwork there.
Oh, thank you.
You see it?
Yeah, no, I see it.
So neat.
Yeah. I noticed that earlier. I was thinking maybe something I could do is like maybe gold leaf on like little sections of it. That could be really cool.
Yeah. Shiny.
Yeah.
All right. Well, everyone have a great week, and we will see you next week.
Bye-bye.
Bye.
We hope you've enjoyed this week's episode.
Remember, the conversation doesn't end here.
Keep the dialogue going by connecting with us on social media posted in the links below, or by visiting our website.
Together, let's continue to redefine nursing and shape a brighter future for those we care for. Until next time, take care, stay curious, and keep nurturing those connections.
And don't forget to be kind to yourself.